Welcome to What's Happening at Tri-City Medical Center. This episode features Dr. Jason Curry, who practices physical medicine and rehab at Tri-City Medical Center. Dr. Curry joins us to talk about spine and joint health. Doctor, what kind of back and neck pain do you evaluate and deal with?
Well, I treat all aspects of back and neck pain, which can be a complex thing. And so I brought in a spine model today to sort of illustrate different areas of the spine that can cause pain, just so everyone can get a feel of the different areas that can cause the pain to begin with. And so this is a model of the lower back or the lumbar spine. And this is looking at someone from the back side here. And so from the back, you can see the sacrum, and that connects to the lumbar spine vertebrae. And so each vertebrae, I'm going to turn the spine sideways here, each vertebral body is connected to each other in these things in the back called the facets or the lumbar spine joints. And you can think of these facets almost like Legos, where each part of the spine connects to each other. And these joints are true joints, just like any other joints of the body, hand, wrist, knees. These joints are true, what we say, synovial joints, in that they have fluid in them, they have cartilage in them, and these joints over time can develop arthritis, which can cause an aching pain located in the back. Typically does not radiate down the legs or down the arms because it's not a pinched nerve type pain, it's a joint pain, and so someone will experience confined pain to the back or neck. So that's one area of the spine where someone can develop pain from. Going back to the side view here of this model, between each vertebral body is a disc. This disc has a job of trying to cushion the vertebral bodies so that they have cushion and that you don't get bone-on-bone contact. These discs are the discs that someone will herniate. You hear someone say, I herniated my disc. What that means is this disc actually can protrude out and come out here and contact the nerve root. And you have a nerve root leaving the spine at every level, and these nerve roots run down the legs or run down the arm, depending if it's from the neck. And so if a disc herniates and hits a nerve root, it'll send pain down the arm or down the leg. And so that's a different type of pain quality that you have to evaluate for. And finally, one of the other common areas of back or spine pain that someone can develop pain from is something called central stenosis. What central stenosis is the word stenosis is the medical word meaning narrowing. You can think of it as tightness. That's where you can get narrowing inside the spine itself around the spinal cord, and that can constrict the spinal cord, causing pain. So those are some very common areas of the spine that I treat.
In stenosis, is the pain limited to the back, or does that radiate, or could it be either way?
It could be either way. It depends on what kind of stenosis. If it's central stenosis, typically it's confined to the back. It'll maybe radiate down into the back of the buttocks or the thighs. If it's something called foraminal stenosis, which is narrowing around the nerve root at the foramen or the opening where the nerve root exits, that will send the pain down the arm or leg.
So obviously there's a range of treatment options. Are they significantly different for those three conditions that you mentioned?
They are. They're very different. And going back to sort of what my goal for patients is to decrease their pain, thereby getting them in with a physical therapist to set up a home exercise program or help them resume that home exercise program they were on before. And so depending on the type of pain generator they have, an injection may be offered to help with that pain. For instance, if it's a pinched nerve that someone has a problem with where this disc is herniating out or pushing out on the nerve root, something called an epidural steroid injection may be offered. An epidural steroid injection is a little bit different than an epidural a female may have when they're giving birth in the hospital. What an epidural steroid injection is in the pain world is using an x-ray machine called a C-arm or a fluoroscope, and you use that x-ray machine to safely guide in a needle around the pinched nerve, and then you inject steroid to decrease inflammation and decrease pain.
Is that an in or outpatient procedure?
This is an outpatient procedure. It is.
And is there a limit to the number of these? How long do they last? Can you give us a little more detail about that?
Yeah, so remember, the goal overall here is to decrease pain so that someone can resume their exercise program or get in with the physical therapist. And so if I offered someone an epidural injection and their pain significantly improves, then the next step is for them to resume those exercises. If down the road their pain comes back or flares up, sometimes the injection's repeated, but the intention should be to try to get that person back in exercising. And so the number of injections you'll hear frequently amongst patients who have had family members get them, they may get a certain number, that sort of thing. I find it's best to individualize my patient care to how that particular patient's doing.
So you're working hand in hand with the physical therapist then?
Yes, exactly.
Part of medicine is of course jargon, just like any other profession. And just for purposes of comparison, what would be the difference between an epidural and a medical branch block, for example?
Right, so a branch block, a medial branch block, targets the joint arthritis. So going back to our spine model here, earlier I discussed how someone can have arthritis of the joints of the spine. And so joint pain is best targeted with something called a medial branch block or facet block. The medial branch is this nerve that I have the tip of my finger on right here. Its job is to do the feeling or the sensation of this joint. And so with the medial branch block, a needle is directed on top of this little nerve, and you inject some numbing medicine, which will then take away the sensation of that joint to decrease pain. So that's a very different procedure than, say, an epidural steroid injection, when the needle is actually coming into the epidural space to target the pinched nerve.
Would the purpose of the medial branch block be to go and exercise or just to get rest?
So a medial branch block is done for a couple of different reasons, both diagnostic and therapeutic. Therapeutic in that hopefully someone will get better with the injection. Diagnostic in that if their pain goes away with this injection, then we have now proven that's where your pain's coming from. And so a couple of different pieces of information will be gathered from that type of injection. Again, sometimes when you perform a medial branch block, the pain will go away and stay away. And if that's the case, then the person should resume their exercise program and once again get in with the physical therapist to set up an exercise program. Sometimes someone's pain will go away temporarily with a medial branch block, and then their pain may return. And for those cases, there's a procedure called radio frequency ablation, or RFA for short. RFA is when the needle comes back to the same place that it did before with the block, but instead of putting numbing medicine there, you heat up the tip of the needle 80 degrees Celsius, and you actually burn away that nerve to the joint, and you take away that joint sensation to have longer pain relief.
Is that something that has to be repeated? It sounds like not. It sounds like that's a one-time.
Well, nerves in our bodies are remarkable in that they can regenerate and regrow. And so studies show 6 to 12 months is usually the window for those kind of nerves to be regenerated. And so 6 to 12 months down the road, someone may experience their back pain or their neck pain returning. If that's the case, then the procedure is then repeated. Typically after a few RFA procedures, the nerve stops regrowing. But again, I can't emphasize enough, enough that that's the whole reason why it's important to have a good exercise program and to work with a physical therapist, because what you do not see on the spine model are all the muscles that are connected to the spine. Where my hands are here in our body, this is all muscle. And so as you strengthen these muscles to support the spine, you'll have your best long-term non-surgical treatment options for your pain.
We've done a great job of taking a complicated issue and breaking it down into its parts. I realize that's not easy. Thank you very much.
Thank you.
For more information on spine and joint health, please visit tricitymed.org.